We must think about eye as a camera. So it has a lens in the front and a film behind. When the lens in the front goes a bit cloudy, we call it cataract. And in principle, cataract surgery is removing the cloudy lens and replacing it with a clear plastic lens. When people have cataract, they start getting various symptoms. The predominant symptoms is blurring of vision, so things go a bit blurry. They also lose a bit of contrast. The colors are not as bright as they used to be. But many people also complain of glare, especially when driving at night, with oncoming headlights being really difficult to see through. When we do cataract surgery, then most or sometimes all of these symptoms go because the cloudiness and scattering of the light within the eye that is caused by the cataract is not there anymore because you have the clear plastic lens. There are different types of cataract surgery, but the types are mainly on the basis of what the patient wants to achieve. The technique of cataract surgery is not vastly different, but the lens that we put in inside the eye can be different in different cases. Some patients would like to have the ability to see without glasses for distance as well as close. Some patients would like to have very good distant vision and do not mind close work with glasses. Depending on the need and the choice of the patient, the lens that we put in is different. You sometimes have to explain to the patient that each different outcomes have their own risks. So you gain lots of things, but you might lose something else. For example, if you have a multifocal lens, which will allow you to see distance as well as read without glasses, some patients will have a symptom of glare, especially in bright lights, which may or may not be acceptable. There are sometimes need for top-ups using laser to correct the residual refraction that is left after the cataract surgery. So I would encourage the patient to have a detailed discussion with the surgeon to find out what the expected outcome could be and what are the risks with the procedure that they are undertaking. Most of us would require cataract surgery at some point in our lives because forming of cataract is a normal aging change. It is not a disease. Depending on the type of outcome that the patient wants, the lens that is put in the eye is different. The commonest type is called the monofocal lens, where the lens focuses the patient at one point, most commonly at distance, so that they do not need glasses for all practical purposes except reading and close work. That surgery is almost certainly done under local anesthetic, unless a general anesthetic is asked or required. The vast majority will be done just with eye drops, which numb the surface of the eye. It's a painless procedure. The procedure takes about half an hour maximum. In most hands, it is less than 15 minutes. The patient will have to lie flat and there is a bright light from a microscope. And many people tell me that they notice different types of colors while the procedure is going on. And there are different types of sounds from the ultrasound machine that is used to take the cataract out. Other than that, it's painless. Some people feel a bit pressure in the eye, and it's very wet because the eye is lots and lots of drops are put onto the eye during the surgery. It's very quick, and most people notice a difference very quickly. If the cataract surgery goes well, most people would notice a significant improvement within the first week. It's not the final outcome. The final outcome takes up to 3 to 4 weeks to achieve. And I tend to suggest for patients to wait for at least a month before deciding the outcome from the surgery.